Somebody who tested positive for COVID-19 can be cared at home as long as there are only mild symptoms or no symptoms at all. A person like that would probably have a cough or some fever or something like that, which can resemble, say, a bad cold or a flu. And in the case of a bad cold or flu, you can also stay at home. So yes, persons like that can stay at home, be cared for at home. Of course, the moment that the symptoms get worse, then of course the person needs to be brought to a hospital for further medical care. And therefore it's important that on a regular basis, people who are in home isolation, as we say, that they are also followed medically while they're at home. That means every so often a health worker, a doctor checks in about how is the patient doing, so that if things start getting worse, that the patient can be quickly transferred to a hospital. We would also not recommend home isolation, so people who have tested positive, have mild symptoms and want to stay at home. We would not recommend that for people who are older or people who have underlying conditions where we know that if they get sick, they will fall sick very seriously. So if you don't have any underlying conditions, if you're not over 60 and you have only mild symptoms or no symptoms, you can stay at home. But a health worker needs to check in regularly, and ideally also a health worker should check whether your home is fit to do that, to stay at home.